Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Health Care. We're talking about cervical cancer, which is the fourth most common cause of death among women with cancer. But with proper awareness and screening, it is preventable.
Cervical cancer is a disease of the cervix, which is the opening of the uterus, and it is in the end of the vagina. Cervical cancer symptoms include heavy periods, bleeding between periods, bleeding after intercourse. In a woman who has gone through menopause, it may also present as bleeding where periods had stopped prior to that. In advanced cases of cervical cancer, you can have leg swelling, back pain, blood in the urine, and pressure in the pelvis.
What is HPV and its relation to cervical cancer?
HPV is a virus similar to cold viruses, flu viruses, and it is most commonly spread through sexual contact. And the problem with the HPV virus is that it can infect cells in the cervix, vagina, vulva, mouth, throat, anus, and it can stay in those cells and change them. It can make them immortal, so they continue to grow and eventually could become a cancer.
How important is the HPV vaccine in preventing cervical cancer?
Cervical cancer is the only cancer that we can prevent with a vaccine. And the vaccine is best given at a young age, where the immune system can develop a very good response and will have that response ready to attack the HPV virus when someone is exposed years later.
Is the HPV virus the sole way to contract cervical cancer?
There are some types of cervical cancer which are extremely rare, but the vast majority, greater than 90%, are due to HPV.
What is a Pap test?
A Pap test is performed by looking into the vagina with an instrument called a speculum, which allows us to see the cervix. When we look at the cervix, we pass a small brush into it to obtain some cells, as well as a spatula to obtain cells on the outside. Sometimes it can cause minor discomfort, but this is a fast test, and most patients tolerate it quite well.
Where would a woman go to get a Pap test?
Many family practice and internal medicine providers are comfortable doing gynecologic pelvic exams and obtaining a Pap test from the cervix. And that may be the easiest way for women to get screened, especially in rural areas where there are fewer gynecologists available.
How often should women be screened?
This comes down to a woman's risk factors for developing cervical cancer. A woman who is in a monogamous, long-term relationship with one partner will have far fewer exposures to the HPV virus, as opposed to someone who has multiple sexual partners. Each sexual partner brings with it the risk of HPV. Also, smoking significantly increases the risk of precancerous changes of the cervix or cervical cancer. So, someone who has low risks can be screened with less frequent PAPs, every 3 years if we're just looking at the cells, and every 5 years if we're looking at the cells and testing for HPV. But women should also let their providers know if anything in their personal history has changed and has put them at higher risk for getting HPV and not being able to get rid of it. That also includes women who have trouble with their immune system, HIV patients, people on chronic steroids, people with transplants. Those patients need to be screened more closely.
What was the result of longer intervals between cervical Pap tests?
Because HPV is the main cause of cervical cancer, and HPV is spread through sexual contact, the hope is that a woman's immune system will fight off HPV in a manner as to which it would fight off a cold. So if someone becomes infected with HPV at, say, 18, that would show up on a Pap test. But that woman may be able to get rid of the HPV virus on her own without any intervention by age 21, when screening guidelines state that we should start testing women with Pap tests. And that's been changed also because we can do what's called co-testing, which is looking at the cells of the cervix and also testing to see if the HPV virus is present in the cells. If there are no HPV seen in the cells, the risk of developing cancer or precancerous changes is very small.